going to perform hand hygiene. As I walk in, I'm going to make sure to close the door behind me to provide privacy. Hello.
Hi.
My name is Denise. I'm going to be your nurse today. Is it okay if I take a look at your wristband? Can you state your name and date of birth?
Destiny Aguilar, March 30, 2002.
Okay. So today I'm going to be performing a head to toe. Do I have your permission?
Yes.
Okay. I'm going to go ahead and put on gloves and make sure that I have the correct equipment. I have my stethoscope, watch, pen light, tongue depressor, and some gauze. Is it okay if I ask you some routine questions?
Yes.
Do you have any allergies?
No.
Do you have any pain today?
No.
Can you tell me where we are?
The hospital,
Can you tell me today's date?
May 28, 2021.
Okay. And can you tell me why you're here today?
I came to see the doctor for a checkup.
Okay. So my patient is alert and oriented times 4. In the last 2 weeks, have you had any thoughts about harming yourself or others?
No.
Okay. So I'm going to begin with the general survey. Patient looks her stated age. Her sexual development is appropriate for gender and age. Her skin tone is even and appropriate for ethnicity. I see no use of visible devices or equipment. No signs of acute distress. Her stature appears appropriate for her age. She appears well nourished. Her posture is erect. Her body symmetric. Body build and contour are appropriate, and there's no obvious physical deformities. In terms of mobility, when my patient walked in earlier, I could see that her gait, foot placement, and arm swing were normal. Moving on to mood and affect, her facial expressions have been appropriate. Mood and affect has been appropriate for today's visit. Speech has been articulate. She appears well groomed. Her clothing is appropriate for today's weather. So I'm going to go ahead and palpate your head. Okay, sorry if I mess up your hair.
It's okay, don't worry.
Head is normal cephalic. There's no lesions, no rashes, no signs of infestation, and no masses. The face is symmetric. Skin tone is even. There's no lesions, no abnormal facial features. I'm going to go ahead and palpate your jaw. Go ahead and open. Close. Okay. So no tenderness noted. Do you feel anything?
No.
No tenderness noted. No crepitus, and patient has full range of motion. Going to palpate your sinuses. So let me know if you feel any tenderness. Maxillary sinuses.
No.
Frontal sinuses. No tenderness noted. I'm going to go ahead and move on to your eyes. So the eyes are symmetric. There's no lesions, no discharge, no signs of infestation of the eyebrows, eyelashes, or eyelids. Looking at the eyeball and iris, I can see that the eyes are aligned. There's no protrusion, no color change. The conjunctiva and sclera, I'm going to assess that next. If you could look up. Okay, so the conjunctiva is pink, the sclera is white. There's no swelling, no lesions, no color change. I'm going to go and test for perla. I'm going to dim the lights. I want you to look straight ahead. And I'm going to come in from this side with my light. Okay. Okay. Good. Okay, if I want to turn the light back on, if you could look and focus straight on the pen. Okay. Pupils are equal, round, and reactive to light and accommodation. I'm going to go ahead and move on to the ears. So the ears are symmetric, they're equal in size, they're proportional to the head, and I see no lesions. I'm going to palpate. Let me know if you feel any tenderness.
No tenderness.
Okay. I'm going to go ahead and look inside. You could tilt your head a little bit. I'm going to pull the ear up and back. No swelling, redness, or discharge. No swelling, redness, or discharge. I'm going to go ahead and move on to the nose. So the nose is symmetric. It's midline on the face. There's no lesions. It's proportional to the other facial features. I'm going to palpate. Any tenderness?
No.
No tenderness noted. If you could look up and look inside. So mucosa is normal red in color with smooth moist surfaces. There's no swelling, no bleeding, discharge, or foreign objects. Good. So I'm going to go ahead and move on to the mouth. So the mouth is symmetric and aligned. The lips are pink and moist with no cracks or lesions. If you could expose your teeth a little bit. Thank you. So teeth are aligned. There's no missing teeth. There's no visible caries. If you could open wider. Buccal mucosa is pink and moist. Tongue is pink and moist. If you can lift up your tongue. Lift, go ahead and lift. No masses or lesions underneath. Where's my... Okay, give me 1 second. So, I'm going to have you open. I'm going to discard that. So you could open. So tonsils are pink with no exudate, 2+, and uvula is midline. I'm going to discard that. Okay. I'm going to move on to the neck. So the neck is symmetric. It's midline. There's no pulsations or masses or bulges. I'm going to go ahead and palpate your lymph nodes. Let me know if you feel any tenderness. So preauricular,
No tenderness.
postauricular,
No.
submandibular,
No.
and cervical.
No.
Okay, so no tenderness, no signs of lymphadenopathy. I'm going to go ahead and check your carotid pulse. So, let me see. Carotid pulse is 2+. Okay, if you could turn to your side. Thank you. I'm going to go ahead and move your head, or your hair. Okay, so I can see that the spine is aligned and symmetric. There's no signs of scoliosis, lordosis, or kyphosis. The AP diameter is less than the transverse diameter. And I'm going to go ahead and check for symmetric expansion. So if you could take a nice deep breath. Okay. So expansion is symmetric. I'm going to check for tactile firmness. If you could say 99 every time you feel my touch.
99, 99, 99, 99.
Okay, so the vibrations are clear and strong bilaterally. Skin was warm to touch. There was no large masses or no tenderness. No tenderness, right?
No.
Okay, no tenderness noted. I'm going to go ahead and auscultate the posterior lung fields, all 8. So I'm going to start here. If you could take a nice, a normal breath every time you feel the stethoscope. And if you want to stop at any point, just go ahead and let me know. We can take a quick break. Okay, to catch your breath. So 1. Okay. 1. 2. 2. 3. 3. 4. 4. 5. 5. 6. 6. 7. 7. 8. 8. All lung sounds clear bilaterally, no adventitious sounds noted. I heard vesicular sounds at all locations except locations 3. Locations 3, I heard bronchovesicular sounds. So I'm going to go ahead and have you turn this way. So I see that the respirations are equal on both sides. There's no use of accessory muscles, and there's no large masses or lesions. Skin is even. I'm going to go ahead and palpate. Let me know if you feel any tenderness.
No. No. No.
Okay. No tenderness noted. Skin is warm to touch. Skin is even. I'm going to go ahead and auscultate the anterior lung fields now. So again, when you feel the stethoscope, just take a nice normal breath and let me know if you want to stop at any point. So 1. 1. 2. 2. 3. 3. 4. 4. 5. 5. 6. 6. 7. 7. 8. 8. Lung sounds clear bilaterally, no adventitious sounds noted. I heard vesicular sounds at all locations but 1 and 2 and 3. Bronchial sounds heard at locations 1. Bronchovesicular sounds heard at locations 2 and 3. So now I'm going to go ahead and check the arms. So arms are symmetric, skin tone is even, hair distribution is even. I'm going to check for range of motion if you go like this. And then extend. Patient has full range of motion of the elbow. Go ahead and go like this. I want you to push against me and then pull. Okay. Muscle strength grade 5. If you could go like this. I'm going to check your cap refill. Less than 2 seconds. Go ahead and flip. I'm going to check your radial pulse. That's 2 plus. Okay. So now I'm going to have you lay down. Thank you. If you could look to your left. And okay. No, I'm going to check the jugular venous pulse. There's no pulsations or distension. Turn to your right. No pulsations or distension. Good job. You're doing a good job so far. I'm going to go ahead and inspect the chest. So it is symmetric, skin tone is even, no masses. I'm going to palpate the apical impulse. If you could turn to your left. And then go ahead and put this hand here. I'm going to go to the 5th intercostal space, left midclavicular line, and palpate the apical impulse. And it is 2 plus, or it's normal. Okay, go ahead and go to your resting position. And I'm going to auscultate the 4 heart valves, first with the diaphragm. I'm going to start at the aortic valve, 2nd intercostal space, right sternal border. Pulmonic valve, left intercostal space, left sternal border. 2nd intercostal space, left sternal border. The tricuspid valve, 4th intercostal space, left sternal border. And then the mitral valve, 5th intercostal space, left midclavicular line. Okay, and I'm going to do that again with the bell. Aortic valve, pulmonic valve, tricuspid valve, and the mitral valve. Okay, S1, S2 heard both times. No murmurs noted. I'm going to go ahead and move on to the abdomen. If you could lift up your shirt a little bit. So the abdomen is flat. There's no distension. It's symmetric. Skin is even. There's no masses or signs of hernia, no scarring or surgical incision sites. I'm going to go ahead and auscultate. Before I do, can I ask when your last bowel movement was?
About an hour ago?
Was it normal in color and texture?
Yes, it was.
Okay. Have you had any changes in ping?
No, it's been the same.
Okay. So I'm going to go ahead and start at the right lower quadrant. Okay. Right upper quadrant. Left upper quadrant. Left lower quadrant. Okay. Bowel sounds are normal active in all 4 quadrants. I'm going to go ahead and palpate. Let me know if you feel any tenderness or pain.
No.
Okay.
No. No. And no.
No muscle guarding, no rigidity, no tenderness, no large masses, no pulsations. So I'm going to go ahead and, you can lower your shirt now. I'm going to go ahead and move on to the legs. So the legs are symmetric, hair distribution is even, skin tone is even. I'm going to check for range of motion. If you could flex both of your knees. And then go ahead and extend them again, put them back. So patient has full range of motion of the knees. I'm going to check muscle strength. If you could pull against me and then push against my arms, good. Muscle strength grade 5. I'm going to check cap refill on the bottom side since she has nail polish. Cap refill is less than 2 seconds. I'm going to check the dorsalis pedis pulse. Good. 2 plus. If I could have you sit up. So for this part, I'm going to have you close your eyes and I'm going to brush a piece of 4x4 on different parts of your body. If you could tell me where and what side.
Okay. Left knee. Right elbow. Left ankle. Right foot. Left hand. And left cheek.
Okay. Patient was able to verbalize all locations correctly. If I could have you stand up. Arms at your side, feet together, and eyes closed. I'm going to have you stand there for 20 seconds. Okay. So 20 seconds have passed by. I've noticed no swaying, indicating a negative wrong word.